Hi, welcome to the case report form return presentation. My name is Khalid Ahmed. I'm also known as Abdul, and I'm the Senior Trial Manager for the CALIBRE trial. I'll be talking about data handling and missing data and also CRF returns today. So this presentation would take around 5 to 10 minutes. It's a very short presentation, but the importance that I really wanted to highlight of missing data and completion of case report forms for the CALIBRE trial. So in terms of source data, what do we classify as source data? Patient reported data, which is the EQ5D5L, which comes directly from the patient, and the patient should be given a EQ5D5L form at their baseline visit, at the 6 months visit, and at the 12 months visit for both the carvedilol arm and the varicose band ligation arm. Lab results are source data, clinical evidence data, health economics data, recruitment, and withdrawal, if applicable, are all source data. In terms of CRFs, CRFs will be paper records completed at sites. So your sites will be completing the case report forms, and these case report forms are all on the CALIBRE website. So please do visit the CALIBRE website where all the latest versions of the CRFs are available. If you cannot access them, then please do email ourselves and we'll forward that on to yourselves. It's already in your site files as well. So please do keep the latest CRFs up to date in your site file. CRFs are considered complete when all data fields are completed and unambiguously or data is marked as unobtainable. So please do complete every field of the CRF. The original or a copy of each completed CRF should be sent to BC2 and the original or a copy filed in the ISF. So you could either keep the original or give us the copy, or if you keep the copy, you could give us the original, whichever works best for your trust policies. This is just an example of a CRF. So please, on the top left, there's a trial number. Obviously, this CRF, since publication onto this presentation, this has been updated. The versions have been updated. So this is just merely an example. So the trial number should be on there. Please put the trial number on each page. The trial number initials, site name, for instance, the date of the baseline visit, for instance. This is just an example of a baseline form. The patient's self-declared ethnicity, and this is at the last page of it. There's the code for that, so please do put that on. If there's any blood tests available, this is through standard care blood tests. We are not required, we are not asking any sites to do any additional blood tests for the trial. So these are standard care blood tests for this disease cohort. If they have sodium, for instance, creatinine levels, then please put the most recent to that appointment. If it's not available, then please fill in the not available box. We are, in particular, to calculate our child Pew scores, we are requesting for INR to be put in. If INR is not available, then PTT control or PTT patient, both should be put down. If there's any issues in capturing the PTT control or the PTT patient or the INR, please do contact myself or the data manager or anyone from the CALIBRE team, and we'll discuss this further. So just to reiterate, we need INR. If INR is not available, then the PTT control and PTT patient is vital. So please do complete all fields. Say, for instance, concomitant medication. All the fields need to be put down as yes or no. If it's a yes, then the agent or the brand should be there, such as, for instance, anticoagulants. If it's a yes, then warfarin, for instance, or it could be aspirin or any other anticoagulants. This slide is version control. So at this present in time, this is the most latest version control document. Obviously, this would be changed over time. So I would advise yourselves to view the website where the current versions are on, and please do contact the clinical trials office to find out if this version is still up to date. Over time, throughout the time of CALIBRE, versions will change and we will notify sites via email that the current CRFs have changed, and please do update your site files accordingly. In terms of data management, so missing and ambiguous data will be queried using a DCF or data clarification system. The data manager would contact yourselves with missing data. So staff from BCG will transcribe. So all the data entry would be done in-house at BCTU. So we would require copies of the CRFs or the original sent to us. Site staff will not have access to the CRF online, so you'll only have a read-only view, but can't really alter the data on the database. In terms of data security, physical security measures such as swipe access or locked cabinets, these sort of things are required. As ourselves being the sponsor at your site, we would require these physical security measures to be in place. Access control, only people that are delegated to work on CALIBRE, who are on the delegation log, who have been trained on CALIBRE, should be working on CALIBRE, and other members of staff shouldn't be working on CALIBRE. So we should have that stipulated in the delegation log, who has what duty. Network security measures should be on there at your site: system design and management, operational processes, data processing, data protection registration. All these sort of things need to be in place. As sponsors, we require a 25-year archiving for sites. So sites would be archiving their own site files, for instance. So we require a 25-year archiving policy implemented at your site. In terms of PI responsibilities, so each PI needs to read and approve the latest version of the protocol, sign the delegation log, adhere to the approved protocol, and be really responsible for enrolling only patients or participants who meet the eligibility criteria. So internal site file, so please do keep the site file up to date. The site file will be monitored by study staff or a representative of the sponsor, or maybe it depends on if there is any continuous missing data issues, if there's any ambiguous data queries. So we have taken a risk proportionate approach in terms of monitoring, and this will be done because of continuous missing data, continuous issues with sites. So a on-site monitoring visit may be warranted, but you'll have ample time and plenty of time provided to yourself before a monitoring visit has been or will be conducted. So please keep the eligibility form. The eligibility form is the randomization form, and in one of my other presentations, which is also on the website, is about consent, screening, randomization, and pathways. So please do have a look at that presentation. It's probably about 15-20 minutes long, and that is a very important presentation in terms of the routes or the pathways of recruitment and randomization. Paper CRFs, so please keep up to date all the paper CRFs. SAE forms, and talking of the SAE forms, there is another presentation again dedicated to pharmacovigilance, safety reporting, the difference between adverse events, the difference between serious adverse events, and which needs expedited report, which needs not to be expedited. So all those sort of things about SAEs are in that presentation. So please do view that presentation. And also, if there is a need for a file note to be produced, then a file note is produced. A template file note is in the site file. So please do complete that. So finally, to conclude, these are our contact details. So if there is any queries or any issues or anything that you want to be resolved, then please do contact us. Either call us, email us. Always email the trial inbox and CC myself in. And this is the website that all the data, all the information and the documents are available. And the address is below. Please do write to us if you need to be. Thank you very much for listening. Bye.